And I will share my screen. All right, I don't have a whole lot today, but we'll go through things. So if you're not with the school or the health department, we'll ask you to drop off, and this information will be posted on our websites later this week or early next week. Make sure you pass along any information to your staff that may be needed. I really don't have any new updated major information or studies or anything this week. I looked and couldn't really find anything. Your local data you can find on the mystartmap.info webpage. The reason I was almost late today is I completely forgot to pull vaccination data, so I quick pulled this. I can get more specific data for your area if needed. It's also on the MyStartMap site, I believe, and it's on the michigan.gov/coronavirus website as well. This is the data by zip code for the individuals age 16 and over that have gotten at least one dose. Green and darker green are the higher percentages, and pink and darker pink towards red are the lower percentages.
Power on.
So just to give you an idea of that. This next one, I pulled the data for the entire population fully vaccinated. So that's including individuals who may not yet be old enough to get vaccinated. So it's a percent of the entire population. Anything green or darker would be 50% or more, and pink or darker pink towards red is less than 50%. So that's included there. And I can get more specific numbers. We're trying to do that. Actually, I just kind of ran out of time.
Okay.
So I'd ask, just make sure your computers and your phones are on mute for me. That would be great. This I pulled yesterday. These are the hospitalization numbers for children in our regions. Again, we're still having a hard time getting it county specific, but actually we've had a pretty big increase recently. Region 1, which really just includes 2 of the counties that might be on this call. It also includes larger areas like Ingham County. They previously had not had any pediatric hospitalizations, but now they have 7 total. 2 of those are suspected COVID hospitalizations. Region 3 also only includes 2 of our counties, and they have 2 hospitalizations, but they also include large counties like Genesee, Saginaw, and Midland. Region 6, which does include quite a few of our counties, but also includes Kent and Muskegon, is now up to 11 hospitalizations confirmed and suspected from COVID. And Region 7, which does also include several of our counties, had not had any pediatric hospitalizations and now has 1. So I pulled again all of the cases in those that are 5 to 18. For all 19 counties invited to this call, the number is graphed out here with the most recent data on the right, and the orange line is the same case count. Oops, I'm sorry. Goodness, my finger hit the mouse there. The orange line are the totals from this same week of the year last year. And then I'm going to go through each county that's on this call, and same thing, orange line is 2020 and green line is 2021. I put each county on their own slide now because we're getting kind of busy. This first one is for Aranac County, Clare County, Gladwin County, Isabella County, and just a note that the vertical axis is different on some of these slides. Osceola County, Roscommon County, Gratiot County, Montcalm County, Crawford County, Kalkaska County, Lake County, Manistee County, Mason, Mecosta, Misaki, Newaygo, Oceana, and Wexford. So this will all be included in the slides that we'll send out to you later today or tomorrow. So going through the data and modeling update that the state puts together, this week's version, the state as a whole has continued at the high transmission level. The percent positivity on our testing has increased again this week, up to just over 10%. Last week it was 8.8%. Our case rates have continued to increase, just a little bit higher this week at 258.9 cases per million. Last week was 246.3 per million. Still pretty much all of our genotyping is showing the Delta variant. So that is essentially what is spreading through Michigan at this time. 8% of all inpatient beds are occupied by those with COVID, and that has been steadily increasing for the last 11 weeks. Our death rate is pretty stable. Last week, there were 194 deaths related to COVID. So this is just our graph of our case rates. This is the weekly cases per 100,000. So the way the CDC tracks them. This just shows 4 of our demographics. Top left is the percent positivity. So not really decreasing, but not greatly increasing anymore, kind of leveling off. The bottom left is our case rate. Again, still kind of gradually increasing versus maybe starting to level off a bit. Top right is the inpatient beds occupied by COVID patients. And the bottom right are the daily deaths. Often the hospitalizations and deaths kind of lag behind the case rates and percent positivity because people tend to get sicker and die a week or 2 after their illness onset. This is our hospitalization trend. Still increasing, not quite as sharp of an increase as it was in the last 2 surges. So hopefully it'll start to level off and drop soon. These are the age trends. And unfortunately, still our 10 to 19-year-olds are still in that rapidly increasing rate increase group and still our top case rate for age group. This week, they separated out just the school age kids to kind of show the rate of increase has been pretty high in our school age kids. And they also separated out the hospitalization trends for kids. One thing, I'm going to back up. I just don't want to, whoops. So just something of note, looking at how high the cases went in our 10 to 19-year-olds in May compared to now. I mean, I'd say it's maybe about half as high now, but looking at hospitalizations, yeah, I don't know if it's hard to say when you're looking at a picture, but to me, it looks like our hospitalization rates this time around seem to be approaching what they were back in May a little bit more so than what the case rates were last time. I don't know, it might just be in my imagination, but just an illustration here of what our pediatric hospitalization rates look like compared to the last surge. In the US, overall throughout the whole pandemic, just over 16% of all cases have been in children. Over the last week, 26.7% have been in children. And that was the same as the week prior, so hopefully things have been slowing down. Essentially, most of the other statistics are similar to what they have been the last few weeks in terms of the increases in pediatric cases, in testing and positivity. So hopefully nationwide things are slowing down for our kiddos. This last week, there were 94 additional school outbreaks in the state and 451 additional individuals associated with new outbreaks in schools. Just to make this a little easier to look at, I graphed it out again. This shows the number of outbreaks in K through 12 schools in Michigan since September 2nd. The green line are the ongoing outbreaks, so those that have continued to have additional cases within 28 days of their onset. The orange line are new outbreaks that have been developing. Hopefully, you can kind of see it's leveling off. Hopefully, you know, well, we're getting a similar number of new outbreaks each week. This is the number of cases are associated to outbreaks in schools. The green line are those in ongoing outbreaks. The orange line are those in new outbreaks. So again, it's relatively stable in the amount of kids and adults that are associated with new outbreaks each week. But obviously, you know, they keep adding to the established outbreaks. The state kind of pulled this data out and pulled out the school age kids, the 5 to 18-year-olds, to show their case rate from the beginning of August until now, just to show how they've been disproportionately affected since school has started, just to illustrate that. And then using what they know about masking use in schools, trying to look at the case rates in 5 to 18-year-olds in counties that have more masking rules, and just showing the case rate increases compared to each of those, whether they have aggressive masking rules, medium masking rules, which they define as just some grades, or based on vaccination status or things like that. And then few mask rules is the last one. So that is all I have today. I know it's not a whole lot. There's just not much new information. Let me stop sharing there and I'll get to the questions. We have been getting, the first question is, we have been getting vaccinated folks as positives. It originally was primarily Pfizer, but now it includes Moderna. Any idea when Moderna boosters will be available and when kids 5 to 11 will be approved? So on the 14th and 15th of this month, the FDA Advisory Committee will meet to discuss both boosters in Johnson & Johnson and Moderna. And then on the 26th of this month, the Advisory Committee will discuss Pfizer vaccination for 5 to 11-year-olds. After that, if you can remember how it works, the FDA Advisory Committee then gives advice to the FDA, and then the FDA decides if it's going to approve the advice and then add an authorization to those vaccines. And then that gives the FDA approval or authorization. And then the Advisory Committee for the CDC gives advice about how they feel the vaccine should be used, and then the CDC approves that advice. So it's kind of a stepwise process, but at least those first steps are scheduled. So likelihood would be that boosters for Moderna and Johnson & Johnson, I would expect we may have some firm guidance and would be rolling forward with those by the end of October, and then by mid-November, be moving forward with vaccinations for 5 to 11-year-olds. Pfizer had said that they also had the data for kids under 5, and that will likely be following, you know, later on down the road. So the next question is, what is the rate of close contacts contacting COVID from school-related close contacts? So in the studies that were done last year in schools that had universal masking and other mitigation measures, it was very low, like around 0.5% to 1%. There's not, well, England has also had no masking, but they've also been testing their student population twice a week for aggressive case finding. They've also been finding that the case rates in their school are similar to the case rates in the community, but again, they're aggressively finding cases, asymptomatic cases with routine testing. It's hard to know unless we're testing and looking for asymptomatic cases, what the conversion rate is, because a lot of kids are asymptomatic. So you may have, let's say you identify 10 close contacts and you may only know that one of them gets sick, but others may have been infected and not symptomatic, and we just never know because we're not testing them. So it is hard because there's not been great studies on all those different scenarios. But again, the studies that have been done have shown that kind of information. So we think it's pretty low, but again, when there's not mitigations or surveillance, we don't really know for sure. The next question is, are teachers able to jump the booster shot line as frontline important workers like occurred with the initial vaccinations? There shouldn't really be any difficulty getting boosters. If you are having trouble with that, let us know. Right now, it's just those who got Pfizer for their initial series, but with the Pfizer vaccine, those that are in a high-risk job, such as teaching, can get the booster. There's no prioritization for that, but again, there should not really be any difficulty getting access to the boosters because we're not seeing shortages of vaccine or of availability like we did in the spring. But if you have educators who are eligible for boosters and having troubles getting boosters, let us know and we'll try to solve that for you. But again, in the spring, the issue then was there wasn't much vaccine available and there was a lot of demand. Now we have a lot of vaccine available and not much demand, so it shouldn't be an issue. The next question, I ordered tests for our school district and the tests that we received all expire October 16th. The expiration date was not extended. The state testing coordinator told our ISD that there is a testing shortage and will not be sending any more tests. Any recommendations or thoughts? I know it's very frustrating. We've been told that there are testing shortages. There's been a lot more demand for rapid testing as more requirements to either be vaccinated or test weekly have come out. A lot of people are choosing to be tested, and so that's taking tests out of your guys' hands. Plus there's been a surge and, et cetera, et cetera. I really don't have great recommendations. We've been communicating with the state and trying to do whatever we can to help with that. We are setting up some testing clinics in some counties, and they seem to have testing supplies available. So we'll make sure to continue to send out information on those, but they're usually just one-time testing events. But anything we get that's more sustained, like community testing sites, we'll make sure to communicate. I would just continue to communicate with the state and keep asking if they have more testing. I would communicate any of these kinds of issues. I would communicate with your legislators, with your congressmen or women, any of those individuals, because we only get what assets are sent, and they may have more power than anybody else. So those are our best ideas. The next one, I recently read a study stating that the effectiveness of the vaccines are showing to lose some of its effectiveness for immunity, but still helps prevent the severity of cases and hospitalizations. Have you heard anything about this and able to talk to it? Yes, absolutely. So for the majority of adults, the effectiveness of the vaccine does hold up extremely well. Mainly those that are older, does the effectiveness drop some, and those who have a very compromised immune system. And even in those and in those who don't have a compromised immune system, it still does an extremely good job at preventing hospitalization and death. I kind of lost my train of thought there. But that is the evidence that we're getting. And so, there's a lot of debate, even if boosters are really even needed. The other issue is it's just statistics as well. If 20% of your population is vaccinated, very few people you'll hear very few incidences of people that are vaccinated getting infected. But if you have 60% of your population vaccinated, you're going to hear about it more often. So the percentage of those that are vaccinated who are getting breakthrough cases will stay the same. It's just that there's a larger bucket of vaccinated people. So unfortunately, you get this illusion like, gosh, the vaccine's not working anymore. Well, no, it's just that more people are vaccinated. And so it's a bigger bucket of individuals. But it is a hard thing to really understand. But again, our main goal, like with the flu vaccine too, is to prevent hospitalization and death. We've had many people who are fully vaccinated get tested after exposure like they're supposed to and find out they're positive by that kind of testing, have no symptoms whatsoever. They add to those statistics of vaccine failure or breakthrough infection, but never would have known they were infected otherwise because they never got sick. So that's our goal with vaccines. The next question is, I have an elderly board member who said he was able to get the Moderna booster through, I'm assuming CVS. Is that possible? So anyone who has a moderate to severe immunocompromising condition, you can get a third dose of Moderna at any time. The pharmacies, I don't think really ask you a whole lot of questions about, whether or not you legitimately need that third dose. We don't require proof of a medical need for that, but we do ask you, what your medical need is for that. But again, if that board member is being treated for cancer or is on an immunocompromising medication or something, they certainly would be eligible for a third dose of Moderna. That's different from a booster, and it gets really, really confusing, I know. But again, if you have people that have any kind of a problem with their immune system, they certainly may be eligible for a third dose of Moderna right now. All right, so those were all of the questions that were in the chat. Before I start losing people on the call, because we've not had a lot of new information coming through, we were thinking about going to every other week with the calls. However, this week there were a lot of good questions, which last week I didn't have. So I'm happy to keep doing them every week if that's the pleasure of the group. If people have a preference, let me know. But if every other week is sufficient, we can do that and free up some of your time. But again, I just want to throw that out there before people start dropping off the call. You can kind of put your vote in the chat if you want. Otherwise, if there's any other questions, feel free to put those in the chat or unmute yourself and ask them. So we're kind of getting 50-50 for every other and for weekly. So I'm going to stick with weekly. And if things start improving and we continue to have a lull, then we'll talk about every other again. So not a problem. But I'll take one last call for questions. And if not, if anyone wanted some additional local data for the vaccines that you can't find on your own, let me know. I'll pull that for you. I'm sorry, I forgot that. I remembered and then forgot it until the last minute today. But just let me know and we'll pull that for you. And we'll get these slides out and get the slides and the recording posted on our websites. So All right, we'll close it up for today, and you guys have a great rest of your week and a great weekend, everybody.